Hello everyone and welcome to Aging Well, our third masterclass. The topic of the webinar today is navigating aged care. For those of you who didn't meet me in previous weeks, my name is Kerryn Tutt. I'm the General Manager of Clinical Therapies and Disability at CatholicCare Sydney, and I will be your moderator today. I would like to begin by acknowledging the Aboriginal peoples of the nations on the lands that we are all meeting from all across Sydney. I'm coming to you today from the Wallandilly Shire and would like to recognise the traditional custodians of the land, the Dharawal and Gundungurra peoples. We acknowledge all elders past, present and emerging and thank them for their stewardship. I'm pleased to see so many people joining the webinar. Thank you for taking the time out of your busy day and joining us on this series of masterclasses. A quick reminder, the registrations are still open for the next two masterclass. If you have already registered, you don't need to re-register, but you can share the link with family and friends who may want to come along. The link to share is catholiccare.org/agingwell. Next week's masterclass is on financial planning for retirement and beyond. The session brings in our financial experts to help you map out your financial needs in retirement. We'll also look at what to prepare for financially and legally from the New South Wales Trustee and Guardian. Today we have two guest speakers, David Fleming and Mary Jane Rudd. Our first presenter is David Fleming. David is the General Manager of Home Care Services at CatholicCare Sydney. David has extensive experience in government and non-government work environments at all levels of operation and has been an executive manager in aged care during the major changes of the past 12 years. David's personal mission statement can be summarised as living a life beyond his imagination, claiming he does not want to be limited by the boundaries of what he currently knows. There's still so much to learn and do. This approach has led to a varied career, which includes a stint as an adult educator, training and developing people who want to provide high levels of service to support clients in new and innovative ways. One of David's passions is to increase self-awareness in others so they too can live a fuller life. To David, it's not so much about gaining knowledge as it is about creating choices that empower people to make decisions that benefit them and take them where they would like to go. Fun facts about David. Just prior to the initial COVID-19 outbreak, David took his family to walk on the Great Wall of China and celebrated a white Christmas in Salzburg, Austria. David is looking forward to being able to travel overseas again soon. Our second presenter is Mary Jane Rudd. Mary Jane is the sales manager at Catholic Healthcare and is responsible for filling the new residential aged care homes across the company. Over the last 15 years, she has worked across both residential and community aged care sector for both private companies and not-for-profits. Mary Jane loves working with older Australians, helping them to seek out services to enable them to live independently wherever they call home. She feels extremely fortunate to have met so many wonderful individuals and their families over her career, hearing their stories and listening to their journey. Fun fact about Mary Jane, she loves cooking and entertaining friends and family at home. She can't wait for the lockdown to end so she can be back to doing what she loves. Before we delve into our presentations, I have some housekeeping to discuss. We welcome your questions, and as this is a webinar and everyone's microphones are automatically switched off, please write questions in the Q&A box found at the bottom of your screens, and we'll raise as many of the questions as we can during the presentation. There is also a chat function which you can use if you would like to make a comment throughout the presentation. This webinar is being recorded and we will share the link to the recording with you following this session. So without further hesitation, I'll hand over to you, David. Thank you.
Thanks, Kerryn, for that lovely introduction. And thank you everyone who's online joining us today. I hope we have some information that's of use to you and your family. I'd also like to acknowledge the Cabral clan of the Darug Nation, who are the traditional custodians of the land from which I'm speaking to you today. And it's really helpful to remember that we all have a past and we all have a future. Today we're going to be covering a session called Navigating Aged Care, and again exploring the choices that are available to people who are wanting to access the aged care system in Australia. We'll be looking at the aged care system as a whole so that we can demonstrate the key parts to that. We'll be looking at how people can stay at home with home care support. We'll be touching on retirement living options and exploring the residential aged care system and how that works. Hopefully technology will behave itself today as we slip through all the slides. I guess one of the key things about the aged care system in Australia is that it's tailored for every stage that you may find yourself in. Initially, we may find ourselves in a place where we don't need a lot of support at all. We call that low support. This might be the time when you're exploring a retirement living option where you live fully independently, but you're changing your living environment so that there are others around you who are in a similar life stage. Retirement living offers a choice of freedom and flexibility. When you're living at home, you may at some point discover that things aren't as easy to manage as they once were. And this is probably a good indicator that a home care option is something worth exploring. This is where services can be provided to you in your own place at times that are convenient to you and that offer you the support to continue living independently for as long as you can. Once your care needs increase and become evidently in need of support, it may be time to consider residential care options. These are options where you get to live in a home, usually owned by a provider, but there are staff available pretty much all the time, so you can call on that help as you need it and when you need it. As an overview, the aged care process really offers two key focus areas: the home and community care-based services and the residential care aged services. But all of those government-supported services are accessed through the My Aged Care portal available on the website. Or you can call them on 1800 200 242, where you can actually register and go through a screening process, which is the initial assessment of which services you are eligible for. Once you share your needs with that particular organisation, they'll arrange a home support assessment, which is the initial assessment to determine what home care services you may be able to access. As needs increase, you may hear of a comprehensive assessment, and this is usually done by an aged care assessment team or an ACAT, and this is the assessment that determines whether you can access a home care package or a residential aged care service. So really, in simple steps, to get any access to funding from the government, you first of all need to call My Aged Care, arrange a face-to-face interview via My Aged Care. Usually there's a wait for your results, which may be only a short wait or a bit longer based on the level of assessment that's being undertaken. And then you'll get a letter which explains what you've been assessed to be able to receive. And that letter outlines quite a lot of detail. Sometimes that letter is confusing, and so services will try to support you to make sense of it. Here's a short video of that experience. This is our CEO at CatholicCare, Mark Phillips.
Yeah, so Mum was starting to have some issues at home in looking after herself. She was having some trips and starting to potentially be a bit vulnerable to falling over, and so we got an ACAT assessment done. which actually took a bit of convincing to get Mum to have that assessment. But we got that done, and then she got registered as a potential participant in the My Aged Care system. So when we got the letter from the government indicating the styles of things that Mum may well be entitled to, she asked me to read that letter, and I couldn't even understand it. It was a very difficult letter to understand. It was quite complicated and detailed. There were multiple steps, and it was using jargon and lingo that Mum didn't understand, but nor did I. And so for a new entrant into this system, it was a fairly impenetrable process.
As you heard, sometimes receiving that letter from My Aged Care can lead to further confusion and a sense of still being unsure about what happens. And that's where we'd encourage you to contact a service like us so that we can work with you to better understand the letter and to explore the options that have been approved for you. But when we're talking specifically about home care, there are generally 3 options that you can access. The first option is what we call fee-for-service or private services. These services are generally user pays and don't actually require access through the My Aged Care service at all. If you have the finances and can afford to simply pay someone to come in and provide the service you need, you can arrange that privately and independently. If, however, you're seeking the government support, the entry-level program is referred to as the Commonwealth Home Support Program, or CHSP. And this is really the first point of service for many people. In that program, you can receive a whole range of program types, but they're usually one service type available on a regular basis. The next level of home care services is what we refer to as home care packages. There are 4 levels of home care packages currently, and as you can see from the diagram on the right of the screen, there are 4 levels. Starting at the green level, level 1 provides approximately $9,000 a year for you to decide which services you want and to spend that purchasing the services that are most suitable to you. As your care needs increase and your approval for a higher level occurs, you can see that at a level 4 home care package, you can potentially access over $52,000 a year. And again, these funds are directed by you, and you can decide what services you want to use and to access with that money. The journey of getting into home care, as we've already talked about, is fairly consistent. You contact My Aged Care, where you register, you undertake an eligibility assessment. If you are approved for CHSP services, you then simply choose your provider. Usually you can find those providers through the online My Aged Care portal. They have a section there called the Service Finder, which will help you find organisations that can deliver those services you are approved for. And generally speaking, once you've contacted that service, you'll be on a slight wait list until they have those funds available to actually start providing services to you. It's pretty straightforward once you're at that point. If you're approved to obtain a home care package, it's slightly different. The first few steps remain the same, where you register on My Aged Care, you have your eligibility assessment, but it's that comprehensive assessment that we referred to earlier. You actually receive an approval for a package level, but that doesn't mean you get a package straight away. That simply means you've been approved to receive a package. You go onto a national queue wait list, which could take only weeks and sometimes many months, because once that package becomes available, it gets reallocated through the system to the next person on the wait list. During that wait time, it's appropriate to contact potential service providers to discuss your needs and to identify with them how they can help you to get the most out of the home care package when it is actually allocated to you. After a while, you'll receive a follow-up letter, which is where your package is assigned to you. That's when you have 56 days to sign up with a home care agreement with the provider of your choice and to get services happening. Payments only start being paid once that home care agreement is signed with your preferred provider. When it comes to home care packages, the service options are quite varied and they're totally up to your preference and your needs. You can see from this slide that there's a range of service types that you can access and spend that package money on. Key types are the day-to-day living services such as light housekeeping, meal preparation, shopping, and transport assistance. As your needs progress, you might want to use your funds for clinical services such as allied health, nursing care, or help with your medications. Of course, there's opportunities to continue in health and wellness options. So there's new areas of technology that can be explored, and your funds in the package can help you to pay for some of that equipment and to attend courses and activities that help you get the most out of those resources. Of course, a key part of aged care is connecting with others, and there's usually funds available in a home care package to provide social support and on occasion respite so that those other carers living with you can have a break. We also encourage people to consider their pastoral and spiritual care needs because sometimes it's helpful to speak to an independent person while you're processing some of the challenges and difficult things that may be happening as you age. I'm now going to pass over to Mary Jane, who will talk to you about retirement living and residential aged care.
Thanks, David, for the overview of home care services. I'd also like to acknowledge the Camaragal community as the traditional landowners of where I'm speaking from today. So let's discuss retirement living. Whilst it isn't a service that's funded under the aged care system, and you don't need to register through My Aged Care to move into retirement living, it's still an important option for many Australians. Retirement living is a lifestyle choice, choosing low maintenance, community environment with activities, like-minded people, beautiful gardens and amenities. Individuals generally enter retirement living when they're living independently and not needing a great deal of care and supports. But if the time does come where you need those services that David spoke about earlier, then you're fully entitled to all of those in the village as it's your home. Often villages also have residential aged care homes attached to the village, which is a big factor for a lot of people these days. So retirement living is all about sitting back and relaxing, enjoying the surrounds and the community and the facility in the retirement period. Regarding fees, they're all separate, they're all done differently by each operator, etc. So it's best to shop around, really ask questions, find out all about the fees, and then I always say it's best to seek some financial advice before signing any contract. So let's move into residential aged care. So this is a service that is funded through the government, and you can only access it through approval with My Aged Care. Generally, when you're ACATed right at the very start of your assessments, people are really allocated a code and approval for residential aged care at this point and respite care. The approval codes don't expire, so it's about just sitting there waiting for you to use it when you need it. So the models of care that we talk about when we talk about residential aged care, it's all designed now about you. It's your home, your care, your lifestyle, your community, and your voice. When you initially arrive at the home, care teams are deployed to create care plans to be about you. Services are then created to meet your needs. What are your likes and your dislikes? What time do you get up in the morning? Do you enjoy a glass of wine in the evening with your meal? This is your home, and we need to know these things about you so we can accommodate for you. So what kind of supports and cares are offered in a residential aged care home? So let's start with ageing in place. This is about catering for your care needs for today and into the future. Do you need assistance with personal care? Would you like a GP to visit you in the room? Or a nurse on call 24/7 and wonderful staff to assist you in your needs? It's about, looking at your mobility. Do you need equipment or additional rails in the bathroom? This is all provided at a residential home, and it's referred to as ageing in place. Most homes now also cater for dementia and palliative care services. So these are sections of the homes, often small wings, that are especially dedicated for these resources. So often we'll have higher staff ratios, different nurses that are trained in different things, etc., to accommodate these individual needs at that time. Respite care is also a service that is offered in many homes these days, and you do need approval for that, which you would get through your ACAT code. Some residents like to use respite as a little try before you buy, see what the home is like and if it's the right feel for them. Others, it's for a little break for their carer who might need to go on holidays or have a medical episode themselves and need some relief from that caring duty. Respite is normally offered in 2-week intervals. And as I said, you do need a referral code to get this. And that's allocated at the time of your ACAT assessment. Finally, in every home, there's also your spiritual and pastoral care. Pastoral care managers operate at many homes. They can support residents and their families through grief and loss, help support residents on finding meaning of life's journey, help celebrate religious days and festivals. Most homes also have an in-house chapel, and church services generally are offered in the home through the local parishes. So let's talk about costs with residential aged care. Basically, there's 3 types of fees. The first 2 fees are set by the government, and it really pays for your care as such. And then the final one is your accommodation. So your basic daily care fee is 85% of the pension. So it equates to about $52.71 a day. This is paid, every Australian pays this amount, and it covers all your clinical needs, meals, basic services that go on in the home. Then you have a means tested fee. This is done through Centrelink. You can ring them and they will give you an estimate over the phone of what you may have to pay. Some people are asked to pay like an additional $2 a day, some $30 a day, depending on your income and your assets at the time of going into care. Your final fee is your accommodation costs. So this is generally a refundable deposit amount that you would pay for the room itself. So if you go into a shared room with shared bathrooms, then that RAD will be much cheaper than a private room with a private bathroom, for example. They can range from anything from 100,000 to $1 million. If you don't have that refundable deposit, you could pay a DAP, which I like to refer to as like a daily rental amount, or you can pay it as a combination of the two, or there's a drawdown service. No Australian would be going without care if you couldn't afford this accommodation cost. A lot of the not-for-profits, all the not-for-profits actually have concessional rooms available. And if you can't afford that accommodation, then you're not asked to pay for that. We ask everyone to always seek their own financial and legal advice before choosing a home. So let's talk about the aged care journey for residential care. As David said before, it's really done at that ACAT part, right at the very beginning of the system, where you register for My Aged Care. You'll then have that ACAT team come out and see you, and they will give you a referral code for both residential aged care and probably respite at the same time as offering you the home care package, etc. The best way to find a home and choosing your home is really to book in a tour and spend some time going out there and meeting management, the team, and get a feel for the home. You'd be really surprised when you walk into a home how different they all feel, and you need to find one that suits you. As all care needs are different, it's important to find a provider also that can meet your care needs. So some providers may specifically specialize in looking after dementia, or they might have a strong mobility program so you can build your mobility back up, etc. It's important to ask all the questions and find out what's important to you. Finally, I would always just say it's never too early to plan for your future. Have a conversation with your family and your loved ones about what you want and how you want your future to look. Plan it together, and remember that some services that are funded through the government do have long wait lists, so it's best to be prepared. Do you want to stay in your home, and can you afford private services, or are you seeking a government-funded package? Do you want to move into a residential retirement village and have services available when and should you need them? Or is a residential aged care home right for you? These are all the questions you should be thinking about and start planning. I'm now going to show you a little video that will summarize everything that we've discussed today and the whole process through the aged care journey. Thank you everyone so much for your time today.
Meet Janice. Janice is 78 years old. Recently, Janice has been experiencing additional health complications, and it's come to that time of life when she needs a little bit of help and support. But where does she start? Catholic Healthcare has a range of care services for every stage: home care, retirement living, residential aged care, or respite care. Home care is for when Janice wants to maintain some independence and stay in her own home. She would love that extra bit of in-home help from our care workers to improve her quality of life and allow her to focus on the things that really matter. Services available include gardening, meal preparation, and transportation. Personal care, clinical services, and health and wellness programs, pastoral and spiritual care, plus many more. Or Janice may prefer to downsize. Retirement living allows Janice to enjoy her retirement with freedom and flexibility without the constant stress of upkeep that comes with owning a property. Janice can enjoy access to transport and outings, on-site facilities, and social programs in a lovely village community. Janice may want to be part of a community with additional access to care and support tailored to meet individual needs and changing circumstances, where there is a range of activities and care options for everyone. Residential aged care provides peace of mind both now and in the future. Or if Janice's daughter has been looking after her but wants to go on a holiday, Janice can seek short-term respite for a couple of weeks at one of our homes. So there you have it. Catholic Healthcare can provide care and support for Janice tailored to her changing needs and wants. For more information, give one of our team a call or visit catholichealthcare.com.au.
Thank you very much, Mary Jane, for your presentation, and thank you, David, for yours. The good news is that we've got lots of time for some questions now. David, I might just get you to click through to the next screen if you can. We're still showing the... That's okay.
I'm sorry, it's not going through to the next screen.
That's okay. We might let Luke, our helper in the background, have a chat with you and help you with that. I might direct the first question to you, Mary Jane.
Of course.
We have a question that asks
Catholic Health.
If additional costs in aged care, is there any help with the cost of medications, personal care items such as deodorants, shampoo and hairdressing, those sorts of costs once people are in an aged care facility?
So generally now what companies are doing is, and we're one of them, we will charge a additional fee per day for residents when they move in. So it might be between, $10, some companies charge up to $100, but that will cover the cost of everything in the home. So from, your toiletries, etc., right through to newspapers, internet, private telephone numbers, etc. The only out-of-pocket expenses, and it changes for each home and each provider, but for us, the only out-of-pocket expenses generally are pharmacy and hairdressing. But even your hairdressing is quite heavily subsidised, so it's only about $10, $15 for a haircut, etc.
Fantastic.
Yeah.
And a lot of facilities now have little hairdressing salons as part of their
Yeah, most of them would
don't
have
they?
hairdressers. We've got masseuses, we've got nail barns, we've got it all going on, coffee shops.
Nice. How soon can I move in, Mary Jane? Thank you for that. David, just a question from Kim. We talked about the complicated letter that comes after an assessment from My Aged Care. Kim's asking, what's the response or solution to that complexity? So what, for example, has CatholicCare done in regards to supporting people with that complexity?
Sure. So the complexity of the letter is based on the different service that someone has been approved for. So for example, if someone's accessing the Commonwealth Home Support Program, they may have a list of maybe 8 or 10 different service types, and each of those service types has a different referral code, which needs to be accessed for that particular service type. So that's about the system being able to connect with the right bits of information. But from a service recipient perspective, that information is really not that relevant. What is most important is that they understand that they want to get this particular service type, for example, some help with home cleaning or some help with transport, that is the service type that's listed in the approval letter. And then all the numbers and everything that happen after that don't make any sense to them at all. That's for the service provider. So our encouragement to any care recipient who contacts us is that we translate the important parts of the information to them so they can understand what services they are approved for and how we can connect them into those service types.
Nice.
If you're getting a letter that's about a home care package, again, because it talks about yourself being approved for a home care package, that makes people think they have a home care package, but they actually have simply been put on the wait list at that point. And the letter explains information about how you go about selecting a provider, what the wait times are, when you're actually assigned a package, how much time you have to sign up for that. That's why it's all confusing for people.
Mm-hmm.
But our encouragement always is, if you get a letter, contact a service provider. They will help make sense for that letter for you.
Okay, that's great advice. And David, just a follow-up question to that, how long are people expecting to wait for a home care package? So they would be, they received a letter saying that they've been approved, they go onto the wait list. What sort of time could people anticipate waiting for that home care package to be allocated to them?
Sure. So it has changed a little bit recently, but there are certainly experiences of people being on a wait list for sometimes between 6 and 18 months before they get assigned a home care package. And of course, a lot changes in that time. What we have encouraged people to do is to actually get on the wait list before you become in desperate need of a home care package. So the idea really is that if you think you might want to go onto a level 1 home care package, you would go through the process and get on the list, and then you have that package allocated to you. And then as your needs increase, you get reassessed and work your way up the different levels of home care packages. I think what happens is a lot of people wait until they're in crisis, so they need the service immediately. And then it's quite distressing because they actually are being placed on the wait list at that point.
Yeah.
So planning ahead is really important, and thinking about what your service needs may be. You can always decline a package when it's offered to you. You don't have to take it just because it's offered to you, but at least then you're on the wait list and you're ready for it when you need it.
Yeah. Fantastic. Thank you. And I know for me personally, when my dad was being assessed for his home care package, I said to him, think about what you need on your worst day, Dad, not your best day, and avoid that temptation to say, I'll be right, mate. I don't need any help, because there's lots of people waiting for a home care package. So if you don't talk about what your needs are, then that assessor will just say, fine, you don't need help, and move on to the next person. So it's really important to be clear with the assessor what the needs are on the worst days.
I think that's great advice for both home care packages and even for the Commonwealth Home Support Program. I've been in situations where the clients know that they have needs, but when the assessor turns up to do the assessment and asks them, what sorts of help could we give you? They don't specify things like, I really need a bit of help with cleaning the bathroom, or I really need a bit of help with getting to doctor's appointments, or I really need a bit of help, being very specific about what are some of the things. If they just say, oh no, I'm okay, they actually get assessed as being okay. So it's very, very important in the assessment process that people recognize this is something that I think I may need, and to put it on the table, remembering that you don't have to have it. You never are forced to take these services. But if you're not considering that you may need them into the future, you are actually delaying the assessment process and lengthening the time before you'll be able to access the services. Yeah,
no, that's good advice. Thank you, David. Mary Jane, I've got another question for you. In fact, I've got lots of questions coming up for you in the feed of questions here. A question from Jessica: can I bring pets into a residential home?
Unfortunately, into retirement living you can. Residential home, unfortunately, no. But what a lot of people do is they do have their pets go to a loved one, and the loved one can bring them in every day and spend time with us, and they become part of the home. They just can't actually sleep there, etc. And we also have pet therapy at most of our homes, which is always a big hit. Yeah.
Nice. Oh, that's lovely. Thank you. David, another question for you. To be entitled for aged care services, what is required? So is it age related, and how old, and do you need a letter from your doctor?
A letter from the doctor always helps, but generally speaking, to access the Commonwealth Home Support Care Program, you need to be 65 or 65 and older, or if you are an Indigenous person, 55 and older. And if you are really an Australian citizen, you're pretty much ticking the boxes to be eligible for the services. They really are entry-level services, and they're designed to be available to as many people as possible. So if you think that you just could use a bit of help with something, go straight to the My Aged Care system and look at the service options and see what works for you. Yep. In terms of a home care package, you really do need to undergo one of those comprehensive assessments, which is done by the aged care assessment team. And that usually requires some demonstrated needs, often health needs, which show some level of deterioration or some level of incapacity. Because there are so many different service types, it's really up to the assessment process, which determines which are those supports that you need.
Sure. Okay, thank you for that, David. Mary Jane, there's a few comments and questions that really relate to what we all think of as the elephant in the room. So the Royal Commission into Aged Care indicated that not all aged care facilities have that sort of rosy experience for people. Certainly nursing services at this stage, and there's no mandated staffing ratios. How should people look to find a quality aged care facility? What are the things that people should be thinking about looking for to make sure that they or their loved ones have a good experience in an aged care facility?
Well, for me, as I said before, I really strongly recommend touring, meeting the staff and the management, talking to the residents. I'll also provide at the end today a list of questions that the government has asked all families and loved ones to ask service providers and to get comfortable with those Q&As when they tour. It includes a lot of things about staff ratio, quality and standards, etc. If you ask all those questions and seek answers for all of them, it will give you comfort in the home and where you're putting your loved one.
Yeah. I think that's really good advice.
And I think at the end of the day, go with your gut. If you feel anything, move them. There's always other homes you can go to. Don't ever think anything's out of your price range because, you know, as I say, the not-for-profit, all of us have a concessional ratio, which is quite high actually. It's around 40% of our beds are concessional. So there's always options somewhere else to find care for a loved one.
Yep. I think
but I'll add
really
that Q&A to our materials at the end of the day, so you can print that off and take it and ask questions.
Thank you. That would be appreciated, Mary Jane. And also we will put the links to the videos there and some abridged slides from today's sessions where we've got detail that people might need to be able to follow up on. David, another question for you. How much do the recipients have to pay towards a home care package? So Mary Jane has talked around fees. Are there fees associated with home care?
Sure. Look, it's a great question, and it's sometimes one that makes a lot of people feel uncomfortable talking about. If I start with the Commonwealth Home Support Program, the program is designed to charge a contribution, which in a ballpark figure is about $10 an hour. So if you were to have someone come and do some cleaning, for example, in your house, you could anticipate that that will cost you $10 and the rest of the service is what the government subsidises. If you compare that to what you would pay for a private cleaner to come into your home, that gives you an idea of some of the money that the government's subsidising in that service for you. When it comes to home care packages, it does get a little bit more complicated, but there are three key bits of information to remember. Firstly, everyone is expected to contribute a basic fee amount. And we talk about daily fees just because it's simpler to think of it as a day rather than a service type. And in a daily fee for a home care package, regardless of the level, it's around $10 a day, regardless of if you have services or not. So you can think about $70 a week for your home care package. What happens then is the rest of the money that gets put into the home care package is the main part of what pays for the services you have, and they get charged by the provider. So it could be, for instance, that you have a cleaning service in a home care package and it costs $60 for all the travel and everything that's involved in getting that service to happen. Most of that is covered by the subsidy that the government pays. You don't pay any more than that, you just pay that contribution fee. The other complexity in home care fees is that they are subject to income tested care fees. So once people are earning any money at all from self sources such as retirement income, then, and if you're not getting a full pension, you'll probably start entering to the space of an income tested care fee, which could be as little as 50 cents a day up to, you know, tens of dollars a day. And that is based on an assessment with Centrelink, and it really is a government forced measure. The only good news to that is that any money that you do pay as an income tested care fee goes towards your lifetime cap. And again, a completely different conversation, but the government sets lifetime caps for how much you pay in aged care. And once you reach that cap, you don't have to pay those fees regardless of what type of aged care you get. So you can see it's quite complicated and very difficult to just give a general overview. But what I would say is, if you think about $10 a day for CHSP, or sorry, $10 an hour for CHSP, and if you think about $10 a day for home care packages, you're probably in the right ballpark.
Yep. Oh, that's very helpful. Thank you, David. If somebody has an assessment or call My Aged Care and they think that they need help and they're rejected by My Aged Care, so My Aged Care says you don't qualify, what would their next steps be if they think that they actually do need some support?
Sure. So I think if they're rejected through the My Aged Care registration process, it's possibly because they don't fit the age criteria. So the age criteria.
So the person asking the question is 80.
Yeah. So I'm not quite sure why that would have been the case. And I would encourage you to contact a service provider such as ours so that we can just have a more personal conversation with you, just to clarify. It could be an example of when you were talking to My Aged Care, it was one of those situations where inadvertently you gave the impression that you were actually okay and not in need of any services. And so as a result of that, they've declined your request. So revisiting that and again, having some knowledge about better ways of expressing the needs that you have may see a different outcome.
Yeah, I would agree, David. I think often the person on the end of the phone has a tick list. They have a form that they're filling in as they go, and providers understand the language that the person with the tick list is going to use, and we can help you with being able to put your needs into the words that people utilize in those systems that could help you to just be able to get your message through. I think that's very good advice. Mary Jane, another question for you, if I may. If a resident in aged care needs special help, such as bedding or chairs for seating, what can be done to help with that?
So there's a few different things with residential aged care. Firstly, the provider should be providing a lot of the equipment in the rooms. I know at Catholic Healthcare, we provide special chairs, all equipment, bedding, linen, etc. Individuals are able to bring in their own bits and pieces into the rooms as well. So, you know, if you have a special recliner chair from home that you love, you can bring that in and have that in the room, a bookshelf or anything like that. If it's actual individual pieces of equipment, such as shower stools or walkers, etc., some individuals have that already when they're at home through their home care package. They might have got it, so they choose to bring it in. If you don't have it at home, we would provide it. So we are funded to provide equipment and anything that you need to keep you safe and independent at the home.
Fantastic. Thank you, Mary Jane. David, a question for you. We've had some great questions, and if we don't get to all the questions, we will, of course, ask our speakers to respond to those questions after the event, and we'll share that in the post-session information. So, David, what happens when somebody deteriorates fast or something happened and they're in need of certain services? So this is a question from Caitlin.
Sure. Thank you for the question. And the truth is that happens all the time. We don't know when we're going to need the services in many instances. And so generally what would happen is that person may go to hospital in a typical scenario. And during their stay in hospital is when the ACAT assessment will be done. And that's when they may get that approval for the home care package, but unfortunately they go onto the wait list until a package becomes available. So during those times, people may be also approved to access some Commonwealth Home Support Program funding. And again, that's subject to service providers having some time available. It's not an easy answer, and we often see people having much higher needs than the services they initially can provide. But that's the process that we would usually come in at some point, start even providing those basic services and looking for opportunities to increase those service levels by advocating for a quicker allocation, a priority rating in the home care package wait list. Sometimes we know that the carers of those people have to take on a lot in the early days. And in those instances, we just really encourage people to seriously consider respite options. For example, some people don't consider this, but just spending a week in a residential care facility, for example, can actually make a huge difference to the carer's ability to keep caring for the person until they get their other home care service options available. So residential care respite is a really important part of the story that people have to consider. It just gives everyone a break and gets us the opportunity to recharge our batteries so we can keep caring for people in those crises situations.
Yeah. No, that's very good advice. And a follow-up question. In terms of the priority on the wait list, so you've talked about the fact that people go onto a waiting list. Is there a benefit in people contacting My Aged Care to see how they're progressing on the wait list? Is it worthwhile to continue to advocate to say, I really need this? Or is it just a case of, you're on the wait list, you should just wait until you're allocated your package?
I don't think there's any harm in contacting My Aged Care to see if they can advise you of where you're up to. The challenge with the wait list is that it's completely subject to a home care package becoming vacant somewhere in the country and then being reallocated to you. So they're not sort of targeted to any specific area or place. They literally are just the number of home care packages that they are, and they get recycled. So once one becomes available, it gets passed through to the next person available. What is exciting as an outcome from the Royal Commission into aged care and in the federal government's funding announcement for this year's budget is they're making 40,000 home care packages available over the next 12 months. So that should go a long way in speeding up that process of how long people have to wait. And if we can trust the government, they also offered to provide an additional 40,000 home care packages in the following financial year. So pretty much, if it all works, over the next 2 years, the wait list will actually reduce substantially, and there should be a lot more packages available.
Fantastic. That is very good news. Mary Jane.
Yes.
Another question for you, if I may, and this is from Gecka. Is aged care only available for citizens, or can it also include permanent residents?
It's you have to be through Centrelink or Medicare to receive aged care services, I believe. Yeah. Sorry, I'm not quite sure on the citizens versus the permanent resident, what the difference is. Sorry.
That's okay.
Yeah. But if you are registered with Medicare, then you should be eligible for aged care.
For aged care.
Yeah.
Okay. Yeah. Thank you.
Yeah.
Okay. Now, another question for you, David. David, what if you have someone living with you? Can you still have a package? And that's a question from Anna.
Yeah. Hi, Anna. You absolutely can. In fact, the home care packages are based on an assessment of an individual. And what happens is once the home care package is allocated, the provider works with that person to identify what are the care needs and who is going to do it. So sometimes some of the care needs the person has will continue to be provided by the family. So living with relatives is very appropriate and very important, and services can still come in. And as much as the family provides support, means that the resources are available to access other areas of support that the family can't provide. So definitely if a person's living there, and there are many instances, for instance, where there's an older couple who are living together and both have a home care package. So there can be more than one home care package in the one home. And again, the provider works with those people to make sure that they get the best out of those packages for that couple.
And David, I might just add on that as well. It's really important that both individuals, if it's an older couple living at home, be assessed, because it's their individual aged care journey. So if one of them ends up going into a residential home, then the other person may be left at home with no services if they're not registered. So it's very important to both be individually registered and have your own journey as such.
Absolutely.
Yeah,
Right.
We see it all the
Great
time
point.
where one person might move into residential aged care and, the husband's then at home and hasn't registered. And so he's years behind and he's been used to getting all these services through his wife's package, but hasn't registered himself. So he's getting nothing. So it's very important to both be registered and both have your own a journey as such and services. Yeah.
That's great advice, and we see it frequently, don't we? That people have challenges if somebody, one part of the couple isn't there. That journey, if you're waiting 18 months for a package, that can be a really long time before that support can be added in.
I think I would add to that there's a lot of people that we come across who think that because they're mostly well, that maybe they're not actually eligible for services or don't need services. And they're the people that I would always encourage to start the journey anyway, because the levels of package and the Commonwealth Home Support Program really can support even the lowest levels of need. And I think what happens is when you're on that journey and you're accessing those lower levels of need, as the more increased need is experienced, it's a much easier to access it. You're not sort of going from nothing into crisis. You're actually growing through the journey as your needs increase. And it's really important that people remember that Australia has committed to providing services to our aging population, and even the smallest of needs is worth starting the journey on.
Lovely, thank you. Well, we had lots of other questions, and I'm sorry we won't get to them, but we will respond to those in writing and after this presentation today. But thank you both very much for your presentations. We really have appreciated your input today. That's been fantastic. So that brings us to the end of our time together. Aging Well is a collaboration of CatholicCare Sydney, Catholic Healthcare, Grief Care, Australian Catholic Super, and New South Wales Public Trustee and Guardian. Our masterclass series are designed to help you navigate some of the hurdles around aging and provide information on where you get further support. I'll take this moment to remind you about next week's masterclass covering financial planning and what to prepare for financially and legally from the New South Wales Trustee and Guardian. This will be on at 10 a.m. Tuesday, the 28th of September. Between now and then, you'll receive an email reminder of next week's masterclass with the Zoom login, plus a link to our Aging Well web pages and further information from today's class, as well as answers to questions. Thank you, David and Mary Jane, for your presentation today. And I'd like to thank Luke Reynolds from CatholicCare Sydney and his team for providing the technical support in the background. Again, thank you for joining us today. We hope you have gained some valuable insights from our presentations, and I look forward to seeing you all next week. Thanks, everyone. Goodbye.